Want to know why? Ask how. Howard the Humongous. On November 22nd, 2022, Gallup, one of the most respected polling organizations in America, issued the result of a survey it did from November 9th to December 2nd. The first line of the report was disturbing. Said Gallup, quote, Americans' self-reports of mental health are their worst in over 20 years. Gallup explained that we've hit a record low in the percentage of our population who say their mental health is excellent. In 2001, 43% of us described our mental health as excellent. That has plunged to 31%, a massive drop. Meanwhile, 24% of us say our mental health is only fair or poor. Why so much gloom, doom, and depression among us? Culprit number one is the pandemic. Boston University says that, quote, depression rates in the U.S. tripled when the pandemic first hit. Gallup adds that it was only 8 months after the pandemic began that those who said their mental health was excellent plummeted 9 points and hit its most abysmal low since the measure was first tracked in 2001. Yes, the COVID pandemic, with its lockdowns, social isolation, work from home, and school shutdowns, seems to be villain number one. It has been an extreme challenge to our mental health. Or, to put it in everyday words, COVID has driven us nuts. Culprit number two, in Gallup's opinion, is what it calls, quote, economic concerns precipitated by the highest inflation rate in more than 4 decades, close quote. The Atlantic adds 5 other culprits doing in our mental health. Gun violence, climate change, and the political environment, not to mention overprotective parents, and of course, social media. What Gallup and the Atlantic do not say is that something remarkable is happening. The big companies that employ more than a third of us are going through what the high prestige corporate consulting firm, the McKinsey & Company, calls a revolution in how they think about, talk about, and cope with all forms of mental health issues. McKinsey explains that a don't ask, don't tell approach to mental health in the workplace is being replaced by do ask, do tell, let's talk. More important, there's been a tectonic shift in the way insurance companies deal with mental health. 25 years ago, if you had a mental health problem, you were utterly and completely on your own. Insurance companies would not pay for a visit to a therapist, much less for a therapist visit every week. That has changed. Prodded by the Mental Health Parity Act of 1996, then by Obamacare in 2010, insurance companies have made a turnaround. Today, they realize that by paying for your visits to your therapist, they are saving themselves money. They know that if they can get your depression and burnout in hand, they can prevent expensive medical conditions such as diabetes, cancer, and coronary artery disease. The result, says McKinsey, is that between 2007 and 2017, the percentage of medical claims associated with behavioral health more than doubled. And the stigma that surrounds confessing to a mental health problem has changed radically. In some youth subcultures, announcing that you have PTSD or borderline personality disorder has actually become a badge of belonging. One result is that, according to Gallup, nearly 1/4 of U.S. adults, 23%, report having visited a psychologist, therapist, psychiatrist, or some other mental health professional in the past 12 months. On average, we visit a mental health care professional 3.2 times a year. That is a remarkable change from the days when seeking professional help was regarded as a mark of shame. But the most amazing figure in the Gallup report is this. Despite COVID, isolation at home, predictions of environmental apocalypse, and the war in the Ukraine, 75% of us describe our mental health as good or excellent. That's a major achievement. Let's hope we're not lying to the pollsters. This is Howard Bloom, speaking to you from the future. It's your job and my job to make, or, want to know why? Ask how.